chilling, but a lonely civilian is as common. And some think we're beefing when we're actually bonding. Or it's common as a senior citizen looking at some pictures when her child was a kid. It ain't nothing like remembering. Or common that shackles on our minds and souls. But how long you think these shackles gonna hold?
As long as I can breathe, I solemnly swear to make a difference.
Okay, welcome to another segment sponsored by Trinity Health. Folks, today our topic is going to be stroke. May is Stroke Awareness Month. You should be having discussions around your kitchen table about strokes can happen to anyone at any time. Black Americans have a higher prevalence of stroke and highest death rate from stroke compared to any other racial group. Hispanic Americans also face a high risk of stroke due to unmanaged risk factors. And learn the acronym FAST warnings. You want to do that, folks, because you want to be prepared for the possibility, but you also want to take preventative measures. But to have a more in-depth conversation, I've invited, and he is so wonderfully accepted, Dr. Muhammad Umar Farooq, medical doctor medical director with the Vascular Neurology Department at Trinity Health Grand Rapids. How you doing, Dr. Farooq?
Very good, Tyrone. Thank you.
I was about to make you director of the Michigan. No, I apologize. Hey, listen, let's jump right to it because this is one of those very important discussions. And many people describe this situation as the silent killer because there's very few things that people can actually identify as a warning sign. We're going to get to that in just a moment. But tell us, what is stroke, Dr. Farooq?
Thank you, Tyrone, for the opportunity. And this is a topic likely very near and dear to my heart. I have special training in stroke and vascular neurology, really would like to share, especially the different perspective of stroke and how stroke happened during this Stroke Awareness Month. So stroke basically is like what you can call like a brain attack, just like heart attack. It's like a brain attack. It occurs when there is a lack of blood supply to the brain. So most of us are aware of, like we have heard about this term like heart attack, right? When somebody has chest pain, they come or rush to the hospital. But that is not the case when there is a brain attack. So brain attack or stroke is the same thing, but there is no pain mostly when somebody has having a stroke or stroke-like symptoms. So that is the reason many people don't come to the hospital. So there are two types of stroke. One is due to blockage in the blood vessel, when the blood vessel is clogged or is blocked and there is lack of blood supply to the brain. That we call ischemic stroke. And the other type of stroke is when there is rupture of the blood vessel and there is leakage of blood inside the brain. That is called hemorrhagic stroke. Majority of strokes are ischemic stroke due to blockage, and approximately 80 to 85% of strokes are ischemic stroke. And almost like 15 to 20% strokes are hemorrhagic stroke.
You know, that's some very serious numbers right there, Doc, that should concern everybody watching right now. Let me ask this, though, as a preliminary warning. You know, what are some of the signs of stroke?
Yeah, it's very important because if you know the signs, then you can act on that, right? So sudden onset of numbness, weakness involving your face, arm, or leg, especially like on one side of the body, that is one of the main indications is somebody is having a stroke. Sometimes sudden onset of confusion, difficulty with speech, difficulty with understanding can also be a sign symptom of stroke as well. The other thing which possibly can be just like, for example, somebody lose vision, like vision loss, sudden vision loss in one eye, very rarely in both eyes, mostly in one eye, or can happen in both eyes as well if somebody is having a stroke in the back of the brain, which control the vision. And you can also see sometimes somebody is having difficulty with walking, unsteady gait, balance problem, especially if any stroke in cerebellum or brainstem, that can lead to trouble walking as well. So these are the main signs which can be seen in both ischemic stroke and hemorrhagic stroke. If somebody is having, for example, like rupture of the blood vessel, as I mentioned, hemorrhagic stroke, mostly those patients have sudden onset of headache, like nausea, vomiting. So it is very important to pay attention to all these signs, symptoms, and also important to make sure that we look for any subtle signs because stroke can cause very mild symptom as well. And as I mentioned, very important point, that there is no pain in most of the patients who have having a stroke. So that is the reason we see many patients don't come to the hospital, or at least don't come to the hospital in a timely fashion.
Yeah. Wow. There was a time my wife thought I had a stroke because I was talking and she couldn't make out what I was saying, her and my daughter. So it made me more curious, at least to investigate more closely what a stroke was and some of the things that I could do to prevent a stroke. Let's talk a little bit about preventing strokes and some of the causes and risk factors related to stroke.
Right, right. So the most important risk factors are basically, if I like to say, that is like hypertension. So really need to pay attention to blood pressure. So I remember my mentor, Dr. Guralik. So I asked him one time, so Dr. Guralik, what is the most important risk factor for stroke? He said hypertension, 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 3 times. So that is really important to pay attention to blood pressure. Uncontrolled blood pressure can lead to a lot of complication, including heart attack and stroke. And Tyrone, as you mentioned, it is silent killer, right?
Yeah.
So hypertension is called because you don't have any symptoms. So many patients have like a blood pressure which is high for a long period of time. They don't pay any attention, and ultimately it can lead to both ischemic stroke or hemorrhagic stroke. Other important risk factors include diabetes, uncontrolled blood glucose level, high cholesterol, and lately what we have seen like obesity is one of the important factor, and that is one of the reason like many young patients are having stroke in their like early 40s, and we are seeing more and more of those patients over the last like several years because of the lifestyle, lack of exercise, and also smoking, and any excessive use of alcohol that can also lead to like stroke or stroke-like symptom as well.
One of the things that I did, Dr. Farooq, is I did take some preventative steps based on that research and talking to my heart doctor. What are some of for instance, what I do as far as that healthy diet is I eat a fruit bowl in the morning and a salad at night, to try and improve that. But there are other things I needed to do. What can't you change that is a risk factor for stroke, though?
Right. So you are absolutely right, Aaron. So there are a few things we cannot change, right? So like, for example, like our like genetic makeup, right? We cannot change that. Some of us are prone to have stroke. We have some genetic disorder and those things. But there are so many things. Very important to remember, 80% of the strokes we can prevent. So this number is quite high if we pay attention to that. If we control our blood pressure properly, we eat properly, do exercise. If somebody is having like stroke, like a sleep apnea, it should be treated. Or if somebody has abnormal heart rhythm, like for example, AFib, like abnormal heart rhythm is quite common. And lately is also, as I mentioned, in young patients, we're seeing that. So if we seek proper medical attention and if we treat all those risk factors, that will really help to prevent the stroke occurrence and the incidence of stroke.
One of the things that I noticed also, let's talk a little bit about age and sex as things we can't change. How does that affect stroke?
Right. So as we age, as you know, the blood vessel get weak, and especially the small blood vessel inside the brain, and that can increase the risk of both ischemic stroke and hemorrhagic stroke. And sex, like women are more prone to have like stroke later on in their life because of the hormonal changes. And also some other racial factors as well. For example, as you mentioned in the beginning, like Afro-Americans are more prone to have stroke as compared to their like non-Hispanic white counterparts. So there is a like study which was done which showed like Afro-Americans are approximately 50% more likely to have stroke as compared to their white adult counterparts, and black men are approximately 70% more likely to die from actually a stroke as compared to the non-Hispanic white adults. And the same thing for women. Afro-American women are twice likely to have a stroke as compared to the non-Hispanic white women. So these are these quite important things to remember, and that comes down to basically different uh, risk factors in Afro-American population, and also we'll see in Hispanics as well. So, for example, like uncontrolled blood pressure, diabetes, smoking, and other risk factors which contribute to this, high incidence of stroke.
I just wanted to quickly mention this too, Dr. Farooq, in regards. Well, I wanted to ask, why is it that it changes? After 65, women are more likely. Before 65, men are more likely.
Right.
What genetically make us up where that happens? What changes?
So that is basically because of the hormonal changes, like especially in women. So the ratio of estrogen, progesterone, and all those. So that makes a difference.
Okay, I see. Well, listen, I really want to thank you, Dr. Farooq, for coming on the program. But one of the things I'd like to do is that this conversation has been so great. I just want to make sure, is there anything else that you feel you would like to add to this conversation that would make it feel more complete for you?
Yeah, I think so. Thank you. Yeah, so I think I would like to mention that the main thing is to understand the risk factors of stroke and know the sign of strokes. And other very important point is, if you see somebody having a stroke, we need to act fast, right? So you might have heard this acronym like FAST. Now we use B fast. So B stands for balance. So E stands for eyes. So if somebody is having a balance issue, or if they're having trouble with their vision, they are not able to see properly, or if we see somebody having a facial droop, which is like FAST, FAST, facial droop, or A stand for arm weakness. So like, for example, somebody is having a drift. So mostly we ask patient to do like this, and if the arm is dropping down, that is a drift in the upper extremities or in the lower extremities. So arm weakness, leg weakness, or somebody has trouble with their speech, that is the time to call 911. Every single second counts, because like if somebody is having a stroke and we don't treat, that patient will lose 2 million neurons. 2 million neurons every minute until we treat that patient. So sooner is better. So we cannot afford to miss the opportunity to treat this patient as soon as possible. That is the reason, we have very robust like program at St. Mary's, Trinity Health Grand Rapids. So when the patient come to the ER, directly go to the CT scanner. We don't waste even a single second. We do a quick CT scan of the brain. We do some like very fancy, actually, the imaging modalities, including CT angiogram, which look at the blood vessels in the neck, in the brain, to make sure there's no blockage. And also we use, it's called CT perfusion, that help us to figure out if patient is a candidate for any intervention. Because nowadays doctors can go with a catheter to the brain and remove the clot mechanically. So there is a window. If we act fast, we can do a lot more for this patient nowadays as compared to able to do in the past.
Listen, again, Dr. Farooq, and I am so glad I asked you that question to just free flow like that. That was very, very informative and very useful and valuable. Thank you so very much. Again, I want to thank you for coming on. Thank you.
Thank you, Tyrone. Thank you for the opportunity. Good to see you.